Hello and welcome to Lymphedema Basics. My name is Kathleen Lisson. I am a lymphedema therapist, and I wanted to put together a presentation which is basically what I would want to tell you if you worked with legs all the time and you wanted to talk to a lymphedema therapist and just get the basics, the big overview of what lymphedema is and what its impact is on the health of the legs. So this is going to be just a series of quotes from several different papers, and then under each of the quotes, you're going to get the citation of the paper. So if you wanted to do a deeper dive, you could look more into this. Obviously, I could give you a lot more information about lymphedema. The certified lymphedema therapist class is 135 hours, so you're not going to learn how to treat it. I just want to give you the basics to give you a good start. So I'm board certified in therapeutic massage and bodywork and a lymphedema therapist in private practice in San Diego, California. And I'm the author of Stress Reduction for Lymphedema. And this is a really good resource. It's in paperback for the client who has lymphedema and wants to add stress management practices to their self-care. So let's start with the definition. Lymphedema is a chronic disease of a fluid accumulation in the interstitium due to insufficient lymphatic drainage. So the goal of the lymphatic system is to take fluid out of the interstitium and then return it to the circulation. So if you have a problem of the lymphatic system is not working well enough, or there's too much fluid into the interstitium and it's like a dam that's about to overflow, either of those reasons can lead to insufficient lymphatic drainage, and that is lymphedema. Lymphedema, there's two main types of lymphedema. It can be primary, so due to something in the genes, or secondary, which is a result of trauma. So that might be surgery, it might be medication, it might be an accident, it might be radiation, it might be chemotherapy, many different causes. And talking about specifically the United States, the vast majority of diagnosed cases of lymphedema in the United States are secondary lymphedema. Primary lymphedema is rarely diagnosed. Much more often, you're going to get the diagnosis of secondary lymphedema. And it's important to know that the most common cause of lymphedema in the entire world, across the world, is lymphatic filariasis, but we rarely, if ever, see that in America. Most of the cases of lymphedema in America are not going to be lymphatic filariasis. So let's talk about how we look at lymphedema. So the International Society of Lymphology categorizes lymphedema into 4 stages based on the severity of the swelling and the tissue changes. So stage 0 is subclinical. So there's problems with the lymphatic transport, but you're not seeing any visible swelling of the limb yet. So we do still say that, yes, if you have some problems with the lymphatics, you are still having lymphedema. It's a stage 0 lymphedema, even though you cannot tell with a measuring tape that this person would have lymphedema. The measuring tape starts in stage 1. So this stage 1 is a reversible swelling. And this is often the person will say, oh, it swells. But then if I elevate it, if I raise my legs up, then the swelling goes away. The swelling comes and goes away and comes back and goes away. That's stage 1. Even though the swelling reverses sometimes, they still do have lymphedema. Stage 2 is when you're getting into the swelling that's permanent. It does not resolve completely with elevation. So the person is going to be living with swelling on a regular basis of that limb. And this is like a very wide stage because they move into stage 3 when they have that stage 2 non-resolving swelling, but they are now also having fat deposition and significant skin changes. So you will start to see that if you do decongestive therapy in stage 1, in stage 2, you can get that limb down. You can get it to where that swelling is minimized. But in stage 3, fat deposition will come. Fibrosis is present in all stages, but you will also see issues with fibrosis and then significant skin changes also in stage 3. It's important to know that not all lymphedema is stage 3. So if you are only looking and only pointing to something and calling it lymphedema, if it's a big giant limb that has it's much bigger than the alternate limb. There's nothing that they can do to change it, and there's skin changes happening in the skin of that limb. You are missing many, many cases of lymphedema. So understand that lymphedema is more than just the big giant leg with the skin changes. That is actually the worst of the stages. There are many lesser stages, and there's many things that we can do at stage 1 and stage 2 to help the client. Complex decongestive therapy can help clients. So please do not only send people to the lymphedema therapist if they are stage 3. So Meige disease or Meige-like disease is the most common form of lower limb primary lymphedema. So now we're talking a little bit more about this primary lymphedema, the one that has a genetic cause. And of all the types of primary lymphedema, it's Meige disease or a Meige-like disease is the most common form of primary lymphedema in the lower limb. But secondary lymphedema, venous disease is the most common cause. So this is what we see in America as the majority of lymphedema cases is phlebolymphodema or vein disease, putting too much fluid into the interstitium, and then the lymphatic system cannot handle that increased lymphatic load. So vein disease is the most common cause of lower limb secondary lymphedema, followed by obesity, according to a study at an outpatient chronic wound management clinic. This study is in Canada, but we also see these results in America. So it may, just because someone has a swollen limb, it may not automatically be lymphedema. What are some differential diagnoses? It can be lipedema, which is a loose connective tissue disease. It can be venous disease, hypoalbuminemia, which is issues with albumin. It can be myxedema. It can be infection. It can be morbid obesity. So not all cases of larger legs are lymphedema. It's important to understand the differential diagnoses of this disease. And it's important to also know that it's not just a pick one and figure out what it is. Patients can have more than one disease at the same time. Patients can have vein disease and lipedema and lymphedema all at the same time. So it's not just get to one diagnosis and then we're done. So we also have to understand that sometimes it's medications that are affecting swelling and medications that may have a negative impact if you have a client that has lymphedema. So some commonly prescribed cardiovascular, anti-diabetic, and chemotherapy agents can have a negative effect on the body's lymphatic system. And this is a really great article to get you some more information about that topic, but it's important to understand that there's medications that are out there that are going to have a negative effect on your client's lymphedema. Also, just stepping out of the lower legs and looking at upper limb lymphedema for just a moment and trunk lymphedema, there are 6 independent risk factors for breast cancer-related lymphedema. If the client has more than 10 lymph nodes dissected, whether they were cancerous or not, So many people want to tell me whether the nodes were cancerous or not. It's the fact that the nodes are out of the body. If they have radiation therapy, if they don't have functional exercise, if they had certain types of chemotherapy, if they have a higher BMI, and if they have hypertension. All of these are risk factors for breast cancer related lymphedema. So, what happens? What is a good thing to do if you have a client that has swollen legs and they think they have lymphedema or they do have lymphedema? Complex decongestive therapy delivered by a trained lymphedema therapist is the current gold standard for lymphedema treatment. We see so many things on the shelves of the drugstore. We see so many things advertised on social media. Complex decongestive therapy delivered by the trained lymphedema therapist, and make sure that the person is a trained lymphedema therapist is the gold standard for lymphedema treatment. So CDT consists of two phases: the intensive phase when limb volume is reduced, and then that is followed by the maintenance phase where the patient themselves is the leader in their own maintenance phase. The patient takes over the self-management. So the intensive phase includes 5 components: manual lymphatic drainage, short stretch compression bandages, skin care, exercise, and education in self-care. And all of these work together. So you can't just pull one out. Someone cannot just have the massage and not do the bandaging. Someone cannot just focus on exercise and not understand the importance of skincare, which is the body's protective barrier. And everyone needs to have education in self-care, because as soon as the CDT is over, the patient themselves is in charge of their daily self-care. So the maintenance phase can include whatever that the lymphedema therapist thinks is essential for the maintenance of their individual patient's lymphedema. That could include self-MLD, it should include compression garments. Skincare is very important because we'll look at a little bit about infections like cellulitis in a minute. And then exercise. Exercise is very important. And this may be different from what would happen 20 years ago, 30 years ago, when if after a cancer diagnosis, they were scared that maybe the person shouldn't, lift more than 5 pounds, shouldn't exercise intensely. Exercise is essential. Exercise is actually going to get them a better result with their lymphedema control than not exercising. Kinesiophobia is an issue in this client population, and I cover some of that information in the stress reduction for lymphedema book, because exercise is so important. There's a segment on the importance of exercise. So let's talk a little bit about the bandages. So another thing that is confusing to people who aren't steeped in this, educated in this, there are different types of bandages. So they may all look beige and come in a roll, but we are looking for short stretch bandages. They are different from the ACE type of bandages that you would get at the drugstore. And it's the particular manufacturing of these short stretch bandages and their strength versus ACE bandages that is going to give the proper compression to the client. So they have to buy the proper bandages. They have to use the proper bandages during the CDT, and if they are wrapping during their self-management maintenance phase. So compression bandaging for lymphedema utilizes a combination of short stretch bandages and padding. And compression should be applied with a higher level of tension at the distal portion of the limb. So by that ankle, there's going to be a higher tension on the bandages as they're placed on, and that tension is gradually going to decrease to a lower level of tension in the proximal limb. So that's when you'll hear the terms like graduated compression. They cannot have this, it's less effective to have the same level of compression from in the bottom of the limb and in the top of the limb. The compression level has to be graduated. Lymphedema therapy utilizes that short or low stretch bandage versus the high stretch material of ACE wrap style elastic bandages. So it's important to reinforce if the patient is self-bandaging, they need to understand the importance of using the correct style of bandage. Short stretch bandages are physiologically correct for the purpose of reducing volume of lymphodematous limbs, and they're less likely to cause injury from excessive pressure. And they also have a benefit when the client is exercising, to exercise and do joint movement with short stretch bandages, and foam on is very effective. So if they're in the maintenance phase, they will have a compression garment. And it's important that we screen patients for contraindications before prescribing and applying compression therapy. So this is a really good article to look at the risk and contraindications of medical compression treatment. It's really not as simple as go buy some stockings off of Amazon and that should cure your swelling. The person who is administering the compression garment needs to check all the compression for correct fit, that it fits correctly, and ensure that the patient understands how to take off the garment, how to put on the garment. So you cannot just let the person choose their own garment and put it on themselves. There's a specific way that the garments should be placed on the body, and you have to make sure that the client can take it off, because the least effective compression garment is the compression garment that the client is not invested in wearing, so it ends up neatly folded on their dresser. So we need to have compression that the client actually wears and wears correctly. It's also important to know, without getting too deep into the ins and outs of compression, that particularly when it's like a made to measure, a flat knit compression, that you will find that it may be difficult to put on the first few times. Kind of you have to wash and wear it in, kind of break the garment in a little bit, just the same as a really good pair of shoes may not be comfortable the first time you wear them. You kind of have to break them in. So if someone tries to put the garment on themselves, they say it doesn't fit, you need to remind them that they may need to wear the garment and wash it a few times, and you need to go over again the correct fit of the garment, and then they're actually putting it on correctly. In patients with PAOD, sustained compression with medical compression stockings is contraindicated if you'll see the systolic ankle pressure is under a certain numbers of millimeters of mercury, the toe pressure is under a certain level of millimeters of mercury, and the transcutaneous oxygen pressure is under a certain amount of millimeters of mercury. So it's important to measure these before you put compression on with someone with peripheral arterial occlusive disease. Also, the PAOD compression contraindications if someone has severe cardiac insufficiency, if they have an allergy to the compression material. For everyone, that is a contraindication to making them wear it. And then also the compression of the epifascial arterial bypasses. So this is just more information for you so you understand if somebody is medically compromised, they cannot just go off Amazon and buy a garment. It has to be professionally fitted, and we have to do the proper measurements to make sure that the proper measurements of the body to make sure that it is safe for them to wear. Patients with lymphedema are at an increased risk for infection and should be counseled on how to handle infections in their lymphodematous limb. So this goes back to why this immaculate skincare is so important, because the normal bacterial flora will get into an opening in the skin, whether it's from dry skin, whether they got a cut from their skin, they got a bug bite, they got a sunburn, and there's a break in the skin. Any break in the skin, if it's a limb that has lymphedema, the lymphatic system and the immune system are impaired. So there is more of an opportunity for cellulitis to come out. It's a hot red rash, and they need to go to the emergency room. They need to talk with their physician, possibly go to the emergency room. They may actually have to get into the hospital and get some IV antibiotics to make sure that they are safe. So this counseling on how to handle infections needs to happen for everyone that has lymphedema. Cellulitis is an acute infection of the skin and underlying tissue. It's often caused by normal skin flora entering through a break in the skin. Painful swelling, erythema, heat. These are some of the symptoms that you may hear from the client. This means that they need to get this taken care of immediately. And I recommend to my clients, always, if it's on the limb with lymphedema, always make sure you get that care. Do not listen to a doctor who's not an expert in lymphedema telling you that, oh, it's probably something else. I have heard that with my clients, and particularly if it's a minor, the parents may say, oh, this is great. Doctors think it's something else. It doesn't have anything to do with the lymphedema, only to later have to go to the emergency room and have it taken care of. So it's important for your patient to have a plan in place for what they're going to do and how they're going to monitor if they have any breaks in the skin, if they have any infections in that lymphedema limb. So this is a great segue to familiarize patients with lymphedema risk reduction practices. So this is from the National Lymphedema Network website. This is a really great PDF that will go over the risk reduction practices. So these resources are very important for people who have lymphedema. And in the home stretch, it's important to know that CVI, chronic venous insufficiency, is a risk factor for lymphedema. If someone has CVI, they are at an increased risk for lymphedema, because in a dysfunctional venous system can lead to a dysfunctional lymphatic system. So if you see CVI, you should have in the back of your mind that they're higher at risk for lymphedema. And untreated venous hypertension can permanently damage lymphatic architecture. These are not two systems that don't have an effect on each other. And this is a really great expert opinion consensus from the journal Phlebology. Interestingly, kind of weaving it all together, if patients have varicose veins, if they have compression stocking therapy, which in this study was a class 2 thigh-high stocking worn during the day for a month, it actually improved the levels of biomarkers in their body. It improved the levels of biomarkers associated with endothelial functionality, with inflammation reduction, oxidative stress reduction, and coagulation. So it actually helps attenuate the expression of proteins associated with vascular damage in clients that have human varicose veins. So compression stocking therapy is something that I would recommend you have your eyes on when you see a client with varicose veins. So this is my short presentation. This is just your first taste of the giant fire hose that is learning more about lymphedema, but I hope that these quick pointers, gave you some information that gets you excited about learning more about lymphedema and maybe a little bit more confident about helping clients with lymphedema, and definitely referring them to a lymphedema therapist for treatment, and reinforcing what the lymphedema therapist says about the importance of continued and daily self-management for lymphedema. You can find me on Instagram at Stress Reduction for Lymphedema, and you can find many more of my talks and more information at my website, KathleenHelenLisson.com. Thank you so much and have a great day.